The user perspective is the most important perspective. And within our space, specifically rehabilitation technology, we have seen a graveyard of solutions that went in search of a problem and then were not clinically adopted. Clinical integration is the most difficult thing in our space that we're working in. So how did we mitigate that?
I want to start by asking you, what are you doing with Gravitrex? What is Gravitrex?
Yes, and first let me say thank you for having me here. I'm delighted to be here at CIC in Tokyo, where the energy is amazing. When people ask me what we're doing with Gravitrex, usually I tell them a personal story because I ask them, whether they know somebody who has had to recover their ability to walk after stroke, illness, or major injury. And I tell them about my dad. He was in a car accident in 2022 when a car crashed into a restaurant that he was eating in, which I know is something that you think will never, I thought it would never happen to somebody I know.
It sounds like a movie.
Yeah, I know, it sounds like a movie, and he really felt like he was in a movie when it happened.
Right.
And luckily, no one was killed in that accident. It could have gone much worse. But I watched him go through the painstaking process of recovering his ability to walk. And I realized that the current equipment really doesn't cut it. And that's because in rehabilitation facilities worldwide, they're really stuck between two extremes. At one end of the spectrum, you have these big overhead harness systems, like, I don't know if you've ever seen, but it's like a ceiling track attached into the ceiling. Have you ever seen some of these?
Yeah, and then they attach you so you can move, and it goes like
yes. And you have these harnesses that come down, and those can be effective, but they're really costly. Some of those systems are like $250,000. They take a lot of time to set people up, and they're staff intensive. So in practice, what happens is that just a small percentage of people who need them are able to access those systems for a small amount of time. And at the other end of the spectrum, you have things, really simple tools like a gait belt, but that is hard on the physical therapist, and it is a fall risk for the patient. So Gravitrex was created to build tools that help people take those steps to recovery safely and more often, and to be scalable across the continuum of care. And our lead product is the first easy-to-use mobile gait trainer that delivers constant unweighting, so it takes weight off your feet while you're recovering your ability to walk, with no battery and no power.
So tell me a little bit more about the product. How you say it takes the weight of you, but in practical terms, I'm going to use it.
Right.
Explain to me how do I put it on? How do I use it?
Sure.
I'm having a mobility problem, right?
Exactly. So in practical terms, if you were an individual who had just had a stroke and your gait is irregular, you're weak, and you're going through rehabilitation, you will be with this device that we're talking about right now. You'll be with a physical therapist. The physical therapist will quickly attach some thigh sleeves and a belt, which is the way that you connect to the device. They'll help you stand up and clip into the device. And the device has a mechanical system which creates a lifting force. So the therapist can set 10 pounds, 20 pounds, 50 pounds of weight support, which allows you to begin to practice walking, and you're walking safely, and it's easier for you because the weight has been taken off your feet.
Okay, so this is robotics, what we're talking about a little bit, and
Correct.
it's like this, similar to these exoskeletons that you have that I see in the movies, right?
Correct.
Okay.
Correct. So we're in the same space as those exoskeletons, but a key advantage of this mechanical system is that it allows us to create something which is much more cost-effective and has a smaller footprint.
And when you were saying you address all the range because you have two spectrums, can you explain to me how this device adapts to that range? Because between one and the other.
Absolutely. So, and every geography is going to be different,
Yeah.
but in most cases, there's a continuum of care where you're in an acute facility while you're being medically stabilized,
Yeah.
and then after that, in the U.S., you might go into an inpatient rehab facility or a skilled nursing center straight from the hospital, and then eventually, the hope is that you going through rehabilitation, you're able to make the transition to home, which is where most people want to be
Right.
and recover and stay. And so with Gravitrex, we're creating devices that are scalable, meaning that you could use it from all the way from an inpatient rehab facility all the way eventually to your home. Now,
Right.
our version right now is for rehab facilities. We will have smaller connected devices, which are appropriate for the home setting.
Right. So I have two questions here.
Yeah.
First is, was your dad able to use it, or it came a little bit later?
Unfortunately, it came a little bit too late.
Okay.
The additional thing is that he actually was one of the co-inventors of the device itself.
All right. So it was inspiration and co-inventor.
Yes, he was. And ironically, he was already working on it when he was injured, but he always says he never truly understood what it's like until he faced disability himself.
Well, that's great insight, because it's the user experience in its ultimate conception, right?
Absolutely, absolutely. And our entire team became so much more motivated to work on this once we saw the difficulty that he faced.
Yeah.
He had started to think about this concept because of his mother, my grandmother, who suffered from osteoarthritis in her knees. And so, but I think probably many of us have so many examples in our life of seeing individuals who struggle to walk, and even for me, before what happened to my dad, I worked for many years in a corporate healthcare background, launching products for individuals with aging and frailty.
Yeah.
And I sat in many sessions, talking, listening, market research, insights, hearing individuals talk about how the ability to walk and their ability to maintain that ability to walk meant so much for their autonomy and sense of identity. Even.
Right. No, I mean, you are really changing the life of these people, because when you have mobility problems, also not only affects your daily life, it's also your mental life, your social life, right? And how you get the well-being on yourself.
Absolutely.
What are the challenges that you faced before when you were developing that, and then we can talk about what is next in terms of the technology, right? Because this field has been evolving quite fast, but there are two areas, right? You have the area of the physical robotics and how it works, and there's the area of the data, the autonomy, right?
Yes.
So can you explain a little bit more the technical parts behind it? What were the challenges you were facing? How do you solve them? And what is next?
Yes. So in building hardware is challenging, right? Hardware, it's a special breed of entrepreneur who wants to and team who wants to address hardware challenges, because hardware is not an easy feat. And
things break in real part. It's not like data that you erase and then come back, right?
No. Things really break. You think they're going to work, they don't work. You have to keep trying. And with hardware, I feel like you often feel like the solution is just over the hill, and if you could just tweak it a little bit more, you'll get there. There's two main things. I mean, one is that in hardware, thinking about feature creep is difficult, and so what I have done in order to get us to where we are is to keep really, really focused on the core element that we're delivering, and not allowing feature creep for the device, for the demo. We want to get it out there as soon as possible. We want to get it into people's hands, because the second part of this is that the user perspective is the most important perspective. And within our space, specifically rehabilitation technology, we have seen a graveyard of solutions that went in search of a problem and then were not clinically adopted. Clinical integration is the most difficult thing in our space that we're working in. So how did we mitigate that? we incorporated users from the very beginning. So we had users, and when I talk about users, I'm primarily talking about the user stakeholders of the physical therapist, but also talking to end users, also talking to caregivers is very important. But in order to make sure that that we can create a product that will be adopted by therapists, it's really important for them to make it so easy and fast for them to use. And we learned this through talking to them. Before we even talk about what we're creating, we deeply understand the problem, and then we put them embedded as part of the process for creating our beta design. And actually, having AI and the opportunity to develop, to generate professional looking images really quickly was so helpful in our beta design process, because people can talk to you about something, but until they really have something to react to and see, it's difficult. So even our engineers and our designers were saying that this was, they had never seen so much iteration during this phase before they actually built something.
Well, that's wonderful. You follow this iteration process and stakeholder alignment and feedback loops. I have an additional question on that, because you were talking about all the stakeholders that are going to use it, but you also have the market, and the market, you have the insurances and the hospitals.
Correct.
How do you test it for that too?
Correct. Well, we also talk and get insights from users. So in our case in post-acute care, again, this is in the US specifically, but when we did our original insights work to develop our product requirements document, we identified huge opportunity in the inpatient rehab facilities, skilled nursing centers, and outpatient neuro facilities. Since we created the beta device, what we are hearing is loud and clear is that individuals in skilled nursing really want this right now. And that's where talking to the administrators of these facilities, the one who are making the decision about purchase, they're telling us, this is why it would be important to us, and these are the metrics that we need to see in order to support the business case. And then that drives everything, right? That drives, if they say these are the 3 metrics that are going to drive our business case, then we set up the clinical studies to make sure that we meet those metrics, and that drives the entire process.
I love what you were saying, because basically that is putting the commercial case to give you the inputs of the design.
Exactly.
And then you can align directly. You don't have to re-engineer everything when you're in the end. You are doing it from the scratch. And that, I think, is a very wise way of addressing the market.
Well, it's something that I learned the hard way after years of being in the commercial space and initially maybe launching products that I thought this would be, it's going to make such an impact on people's health. But if you don't consider the needs of the user and adapt it to the way that they do things, then you're never going to make that impact. So they're always first.
Yeah, no, absolutely. Well, thank you for sharing that. And you are doing this in Arizona,
correct?
Of all places.
Yes.
And when someone asks about startups or robotic startups, they don't say Arizona, right? So tell me how it is to do something like what you are doing right now in an ecosystem like Arizona that probably is smaller, that you don't have so many access to sophisticated capital or sophisticated mentors or technology. But on the same token, it's smaller, so you can build relationships faster. So tell me a little bit how it is to build a company like yours with cases that are worldwide and a potential market in the US by worldwide, and addressing such an important issue that has an impact globally in Arizona.
Yes. So we really have an unfair advantage building in Arizona, because Arizona, while it may not be the first place that people think of when they think about medical device startups, it has an extremely collaborative ecosystem. And the energy in Arizona is real, but there's this really collaborative energy that you feel in Arizona. And expert guidance from mentors who give back so much of their time, and that has really helped us to move forward. In addition to funding from the Arizona Wear Tech Center, we received a grant of non-dilutive funding, which it let us go literally from a garage prototype to the beta device that we are now demonstrating in rehabilitation facilities.
You're doing hard work. You need some support to be able to go through that part,
right? Exactly. So I am an extremely proud cheerleader for Arizona.
No, but I think that's something unknown to people because they don't think about that. It's okay, if I'm going to do robotics, I'm going to go to a big ecosystem. And sometimes smaller ecosystems have more advantage because you can move faster or find your niche, right? So this is a perfect example. Thank you for sharing that and highlighting Arizona. It's a good place, so other people can come also and build this ecosystem together. I want to go back to you, Gravitrex, and the challenge that you are doing, because by now you know very well this area, and you know the technology very well. You know the market also well. So just going a little bit in your vision to think about how, if everything goes well, if you can get what you are thinking on and putting your vision into place now, how do you see the wall of this rehabilitation and this mobility support for patients in 5 years from now? How the life of people will change?
So today, what's happening, as I mentioned, is there's this technology gap, and so many people don't have access and aren't getting the steps they need. If things go the way that I see them going, in 5 years, when someone gets out of an acute facility and goes into a post-acute facility, they will be given a Gravitrex so they can take early steps often and safely. They'll get more steps in so that they are able to more optimally recover. And then they go home and they're able to continue that recovery that they will need by using a Gravitrex device that's smaller and more and fit for the home setting. And it will be connected. It will be connected with diagnostics and AI so that it can evaluate their gait. And the physical therapist can monitor them remotely so that they can assure that their recovery continues to an optimal position.
No, that would be a wonderful solution. I love that part that you can go home and then continue normal and have the interaction probably with the data, more automatic, and some of them just question it. Thank you so much. It's a wonderful vision. I hope you are able to deliver it soon, probably sooner than 5 years from now.
Thank you.
That would be fantastic to hear. We usually finish these interviews by asking you for a word of wisdom for other people that really have a similar passion and a similar mission of having an impact through technology and entrepreneurship. So for a person that is starting and thinking, hey, I want to really have this kind of impact, and I'm thinking this technology could be there, what would be your word of advice for them?
My word of advice to them would be to listen to others, but stay focused. Pick the one or two things that you think are really crucial and stay focused on that goal. In our case, it's the user needs and making something that's fast and easy. It's really easy in the startup environment to get distracted. And if you don't stay focused, then you can run out of resources in terms of capital, but also energy. You need to make sure that you stay focused on that goal and incorporating commercialization needs from the very beginning. Commercialization is not an afterthought. The consumer is the most important stakeholder.
Yeah, no, I love it. It's very, very good advice, and I hope that people listening takes it into account, because it's really, I think those are two key areas that we've been seeing. So congratulations on focusing on those areas. Congratulations also on what you are doing. It was a pleasure to have you here. Thank you so much.
Thank you so much to you. I really appreciate it.